Howdy ho, neighborinos. David Duford here at davidduford.com, where help insurance agents like you become top producers. I am joined here by my partner in crime, Mr. Luis Moreno. Say hello today, Luis.
Hey there, guys. Good to be on here, David.
Yeah, so the reason I've brought Luis back on is we did a video a couple weeks ago, I think, Luis, it's been, on ACA, otherwise known as Obamacare.
Obamacare.
And there's actually an opportunity in this particular business model. So I would definitely advise you, after we do this video, check that video out for a longer explanation on how this business works. I'll put the link below. But Luis, yeah, kind of just give us an intro for those people who maybe missed that video on what ACA is all about and what the details are.
You know what? It's a heck of an opportunity for agents. And right now is the time. If you've been sitting on the sidelines, if you've been thinking about, well, should I do this? Should I not? Is there a lot of work? But I would guess the first and foremost question that these agents would have, is there any money in it? That's number one. So why don't we just even talk about that? So what is ACA? What is Obamacare? And is there any kind of money in it? So we'll start off first with what is it? Guys, it's under 65 health insurance. Okay. It is the law. It has not been repealed. There are no penalties for not having it. That was done away with, but it's still health insurance. And people under 65 really have three options. Number one is they go without insurance and they roll the dice. Number two is they go get short-term plans, which we have access to. But most of these plans are going to be fully underwritten. And that is a problem for the unhealthy. Okay. And they're kind of almost stripped down kind of plans. Okay. You're not going to get a lot of doctor co-pays. You're not going to get a lot, or if any kind of prescription coverage. So it's really for the healthy that want it, for that just in case. And then there's the ACA. This is everybody else. The beauty of the ACA, David, is there's no underwriting, but there is a season to get in, open enrollment. And the reason we're trying to push this out to you guys out there, and we're telling you, hey, if you're sitting on the sidelines, you got to hop in now, because open enrollment starts November the 1st. And it only lasts for 45 days. Okay, you have a 45-day window for the entire country to enroll. Now, outside of that window, we have special elections that we can utilize. But it's nowhere near the amount of volume that people are going to do during this open enrollment season. So most definitely, if you're sitting on the sidelines, man, they got to get a hold of you, David. We got to get them set up.
Like you said, this is a sprint, not a marathon. This time at the filming of this, if this is something serious, you got to get moving on this because it's rapidly approaching. So you mentioned the money. How do agents make money? What's the opportunity here?
Talk about money. Okay, so there's no money. I sometimes I was even spreading that rumor out. David, you don't want to do ACA, man. There's no money in it. Let me have it. Let me do all the work. In fact, I'm going to do you a favor, and you know what? You can take care of me some other way. So I would tell you, that's the kind of stuff that was spread out. It's kind of a secret for those that didn't know. But there is a lot of money in ACA. Most carriers pay a dollar amount per head. Okay, and I'm just going to throw out a number, guys. So I'm not going to do the math like I did before. Watch the other video we did, because we got into detail about that. But approximately, if you go out there and you write mom, dad, and 2 kids, my math's not very good, but you're looking at a commission of almost $800 annually for one family that took you, David, if you are slow, man, if one of these agents is super slow, it may take them half an hour to knock out. Half hour, you're making $800. Now, I'm not even talking about all the other stuff that you should put together for this insured. We're talking about maybe adding 2 life insurance policies, or at least one for the breadwinner. They may or may not have it, but you want to at least throw out some kind of term product for that breadwinner. We're talking about adding either hospital indemnity or a metal gap plan that bridges that out-of-pocket maximum, and dental and vision. Man, you can get this thing into the $1,200–1,300 commission for that same family, all in one spot. I mean, it's the amount of potential that an agent has is huge. And let's just round up to $1,000. I'm going to tell you, David, I'm running a full service P&C agency. I got 9 staff. It's a monster. Okay. We're training agents in the course of and doing Medicare in the course of 45 days. And this is, you know, I'm proud of it because, geez, you know, I'm so busy. I was able to knock out over 600 of these, David.
Wow.
So it's doable. Now, my wife never saw me and my kids didn't see me. I mean, I was gone. I told them, you know what, I'm done. I'm out of the family for 45 days. Leave me alone. I have a motorhome at my office, dude. And that was my, you know, I'd shower. That was my place because I'd be done at 2 or 3 o'clock in the morning because you're right, David. This is a sprint.
Right. And
you got to push hard. In 45 days, you got to knock on a whole year's work in 45 days. So it is doable.
Yeah, I think the smart way to look at this, not just from the opportunity of what you could make by selling this in the short period of time, but historically, if you look back, you know, 20 years ago with the normal individual health insurance market, this was the strategy. You go in, you talk a product that everybody knows they need to have, that they need. It's probably the most tangible of all the products out there, but it gets you in the door to sell a lot of other products, and it creates relationships. And so like when I was sold a health insurance plan back like 15 years ago, the guy tried to sell me life insurance too, just like in this strategy. And that's how you boost the average case value of these opportunities. And so I think that's a smart way to look at it as a great opportunity. But, you know, a lot of people who are listening to this kind of are probably used to seeing us talk about Medicare. We talk a lot about the credentialing process, the certification process. How does ACA healthcare compare if we're looking at Medicare? Is it as daunting? Is it simplified? Give us more information.
Okay, I'm going to say this is AHIP. This is Medicare credentialing. Okay, this is ACA. Okay, you can take the test as many times as you want. But guys, after 4 times, I mean, you have A, B, C, D. You know, you can't miss the same question more than 4 times. So take pictures of the questions. You can't go wrong with it. It's maybe a 2-hour course for the new people. For existing or returning agents, I think it took me 15 minutes, and I was done. So
a lot better than AHIP.
Oh yeah. Yeah, and you're right. A lot of people had heard us talking about Medicare, and I want to point this out. You know, and we haven't even got to the marketing side, but man, I get something in my head. It's got to come out, otherwise it's gone. But I'll tell you, David, you know, these agents are like, okay, great, I want to do this. I like the opportunity, but where do I start? Well, your agents have books of business. What would you say, David, on a typical agent, how many of their clients are over 65 and how many would be under 65?
Probably, I would say over 65, 7 out of 10. You know, probably 30%-ish or below 65.
Well, those 30%, guys, that's where you're going to start. You're going to start calling them, hey, David, hey, how's that final expense policy I sold you? Hey, by the way, I'm doing ACA. I'm doing healthcare. I'm going to come by and see you so I can get that taken care of. You know, you work your existing book. And I will tell you, I don't do a lot of advertising. I got a storefront. I put some signs out. I don't do any, I did do some social media ads, which were horrible, but man, I got a lot of stuff from that. But the majority of my business came from referrals. If I take care of you, guess what? They know friends and family that are having trouble, and the referrals will start pouring in. And here's the other thing. We don't have any guidelines, David. You want to chase these people down an aisle? You want to door knock them? You want to get crazy and have, you know, go sit at a Dollar General, a Family Dollar, you name it. We do not have any marketing guidelines other than doing what's ethical and right. But with Medicare, oh geez, there's so many protections for seniors. We got to let them come to us, not with ACA. We get attacked.
What about service work?
Oh, the service work, beautiful. So One of the things that we have that we provide agents that contract with us is we've got a platform that not only can you quote, enroll, but it will manage your health care book of business. Okay. In managing that healthcare book of business, as far as the service work, it's all there for you. I used to hate January, February, and March because during those months, we had to upload documents. Okay. It was a manual process on healthcare. It's a government site with a ton of problems. Okay. It's pretty good now, but still, once you have a bad taste, I don't want to go back. Okay, with this software platform that we're going to give you access to at no cost, you can upload your documents that are required. And the biggest piece of service work, and you have two of them. One is billing. These guys are going to be paying some premiums. Okay, yeah, you got to monitor it. You're going to get emails from the carriers that say, hey, here's your clients that are at risk. You know, you just got to call and remind them. Okay, but the biggest piece of service work was in February. David, what's happening in February for most Americans? Out of curiosity.
Getting tax refunds?
Taxes, yes, they want their taxes. And guess what? They can't process their taxes without that 1095 form. Right. So my God, my phone, Luis, where is my 1095? And I can tell them, they mailed it to you. Well, guess what? They threw it away with all the other stuff. So having to go in there and get that form in the past was a nightmare. Now it's a matter of looking their account up on our platform. Oh, there it is. Copy and shoot them an email. Super easy. So service work, guys, billing, documents, and that 1095. Other than that, there's not much you can do.
Sounds good to me. So Luis, let's talk about next steps if you're interested in this. So actually below this video, guys, you're watching, there's going to be two links. One is going to go to my contact page where you would just send me a message saying, yes, I'm interested. Send me more information. And then I'll send you a contracting link with the carriers that we have available and then ways that you can ask me more questions and Luis too. And then also below this video is a more detailed video, slightly longer video that will talk more about the math behind the business, what you can expect per sale, how all the details work. And it'll help kind of, I think, iron out a little bit more of how things work. So make sure you watch that before you contact me with any other questions, because that'll do a good job of mentioning kind of the extra stuff that maybe we didn't hit on. Luis, do you have any final thoughts here before we wrap this up?
Final thoughts are, guys, again, you're sitting on the sidelines. Now's the time. Come October-ish, if you're going to jump in then, it's hard, guys, because we already shifted from teaching mode to getting ready to sell mode. Guys, if you know nothing about healthcare, we can help you. So I've got a training program that I put together, eight modules. We've got them recorded. We will give you access to that so you can catch up. We've got a chat room for our agents that are doing ACA, where you've got other agents that have been in the business just like me, where we're all collaborating and helping each other out. And then we have Zoom trainings on Wednesday, 9 a.m. Central. Okay, these Zoom trainings right now are being recorded. And right now I'm in the middle of this 8-week or this 8-module course, and we're doing the quoting. But you can get caught up. Once you get contracted, that's all that we need. Get contracted with us, and then what we'll do is we're going to open up the floodgates. You're going to have access to our Dropbox where we're storing all these videos. We even have a smart book. I don't have one handy, but I created a smart book with all the information that you need to be successful. We're going to give you access to that. Of course, we can't give you a physical one, but for $2 or $3, take it to Office Depot, Office Max, print it in color because it's pretty cool. Putting in a little binder and you're rocking. So we'll give you that. We're literally going to open the floodgates. And then the last thing that we've got, David, and this is the only value prop that we can come to the table, is you got access to me and my team. Okay, we're going to help you. You're not going to get all this, and we're not going to wish you well. Okay, if you get stuck, we're going to be able to help you out. We've done, you average between 400 to 600 apps a year since Obamacare has been around. So we pretty much hit just about every scenario that's out there. So between me and my team, we'll be able to hold your hand and guide you. But ACA, it's not that hard. It's not Medicare. There's no underwriting issues. It's just a matter of gathering a little bit of data, plugging it into our platform, and you're rocking.
Perfect.
So
Well,
hop
Luis,
on board.
yeah, thanks for being here and explaining this to us. And again, if you're interested, follow the link below to my website. It should be daviddufour.com/contact. And then if you want to learn more about this particular ACA in more detail, especially on the math side, the money side, click in the description box below, or there may be something floating up here at the top that you can click on if it hasn't already showed up. And that will go into another kind of video like this, but more in detail. So, Luis, thanks for your time today. I appreciate it.
David, I'll make one more quick announcement, man. And I know you're going to try to post this out there. This is September the 9th. God, my eyesight's getting bad. But on September the 15th, for any agents that are around the El Paso area, okay, on that date, we're going to be hosting an ACA and Medicare seminar. You're welcome to come join us. David, I know you're very popular out there. If you want to join us, maybe hit David up with an email and then he'll forward it to me and I'll get you some details.
Good idea.
But you can come catch us live at this event.
Perfect. Very good, guys.
Right.
We'll see you later. Thanks, Luis.
Take care, guys.
Bye.